rooms for Facebook, and any questions that may come across Zoom are being monitored as well.
Okay.
And of course, he'll, as a moderator, he'll speak up about that and ask those questions of the individuals.
Okay. I can become wordy. I have my name, so I tried to get it down to, I was trying to do 15 minutes. And I think I went over a little bit. So if somebody goes, don't have a problem. Because I know you want more time for question and answer.
Mr. Kent, I saw you come into the stream with video when I first started the meeting at 6:30.
Oh, yeah.
But I'm noticing you're still trying to connect with audio. So I'm not sure if you just happened to click on this earlier this evening or what, but if you can hear me, we cannot hear you and we cannot see you.
I'll send him a text.
By the way, to make sure I'm clear, is that Dr. Kent?
Yeah,
last name?
he is. That's how we know each other. We were classmates. We were roommates. I'll send him a text. If I can.
Okay, so we are now streaming to Facebook, the Rockdale County website, as well as YouTube. So from this point on, any audio or visual that you are showing will be broadcast out live.
Okay.
So you can mute if you like, or you can turn your cameras off if you like.
Hi, Lois. I just sent him a text, so I'll see.
Hey, Miss Bunny, how are you?
I'm good. How are you? Nice to see you.
Good seeing you.
Mr. Carr, you're looking pretty sharp there, my brother.
You see me okay? Oh, that's right. You're talking about Lewis.
Thank you, sir. I'm representing.
Oh, you're on.
Yeah, but I think I got too much light behind me, so I'm going to change.
Yeah, if you could get rid of that light, yeah, that would probably help.
Hey, Sean, just want you to know that I'm on here. Hopefully you can hear me and see me.
Yes, sir, I can.
Perfect. Thank you. I'm going to leave it on mute for 1 second as I'm pulling up my computer to get the agenda, okay?
Okay.
Okay.
Just as a reminder, we are live on Facebook, YouTube, as well as the Rockdale County website. Director of Public Relations for Rockdale County will be moderating this evening. As you saw, he just joined in. Please remember to, if you're not going to be speaking for a while, please mute your mic just to lower the ambient sound and any disturbances that may occur. If you have any questions during the time frame, Mr. Diaz will certainly answer those. If not, he will ask me to step in to resolve any technical issues.
Good evening, everyone. And Sean, you can let me know if we are not live, but I believe you share that we are live on Facebook. My name is George Diaz, and I'd like to welcome everyone to the Dispel the Myth Town Hall. First of all, we definitely would like to thank the Progressive Club, Mr. Al Sadler, Mr. Lewis Carr in particular, for helping us bring this on our radar and allowing us to partner with them. We definitely want to give most of the kudos, if not all the kudos, to their group and their leadership. We are just here to be a spoke on the wheel and help them not only broadcast, but hopefully move through just this agenda. The time right now that I have is 7 o'clock. I wanted to allow us to have maybe 2 or 3 minutes before we start to give a few other folks some time to join the stream on Facebook, and also give our speakers and our presenters a few minutes to get adjusted. Sean, if we do not have all the speakers already logged in on Zoom, please let me know. But if I don't hear anything from you, I am taking that as confirmation that we are good to go. So the time now is 7:01, and unless anybody has any objection, we will wait to about 7:02, 7:03.
Director Diaz, I believe everyone is here from my recollection.
And do we have the chairman also joining us yet?
I have not seen the chairman on here.
Okay, and I spoke with him earlier. Let's give him a few minutes, and I will come back on camera somewhere between 7:03 and 7:04.
Well, hello, Dr. Griffin. It's nice to put a face with a voice.
Hey, me, I didn't know if you were on audio or not. So
I had turned it off.
Okay.
I had turned it off, and I looked up. I said, "He's there."
Hello, Kent. How you doing, sir?
Good afternoon. Good evening. How you doing today? Good to see you.
I'm doing just fine. And Lewis?
I'm always good. Living in Conyers, you're great.
Well, being a native, you're great too. So I don't live there anymore, but at least I feel like that's my home. So good to see you, Bonnie.
She muted you.
It's been a while.
Yeah.
It's been a while. Hello.
Yes, I got a gift in the mail today. I was trying to do this with the view of the bay, but too much light coming in. It's only 4 o'clock here.
And it's almost my bedtime here. So
I know.
Yeah, I heard you went to bed with the chickens.
I have to. I get up with them too.
Okay. Oh, I forgot we were live on Sunday.
That's right.
Well, we're not saying anything too bad, right?
No.
No, this is a great forum. I hope. Hopefully we can get some good information out.
I'm sure we will.
Well, let me ask you all, do you all want to let the questions be asked at the end of the presentation or as we go along?
I would say at the end, because it's going to draw out other stuff and kind of get into your presentation, maybe a little, eliminate some of your presentation time possibly.
No, and I agree with Mr. Carr. One of the things that we'll do is if viewers or people who are viewing us have a question, they can submit it to us via the Facebook feed or the Facebook chat. And Sean, if you'll be letting me know, you can text me on my personal phone, Sean, as we get some of those questions. And it sounds like the chairman will also be joining us soon. Let me just make sure I can help him through his technical difficulties. Give me 1 second, folks.
Okay.
Sean, if you will please, I have the chairman on the other line. Just keep an eye out to see if he's already given, waiting to be led into the room.
Director Diaz, is he using his phone?
Yes, he is using his phone, Sean. And Mr. Chairman, can you tell me what the last four? 9446, Sean, are the last four of the number he's using. Sean, it looks like the chairman should now be gaining access if you will let him in.
Not seeing him coming in right now.
He says he's waiting. He's getting an alert that says waiting for him to be led into the room.
He's not in on this meeting right now.
Well, give me 1 second. Okay, folks, thank you so much. We are sorry for the delay. It is now 7:07. We tried to get some technical difficulties worked out for the chairman, but due to some circumstances out of our control, he is going to be joining us via the phone that I'm on right now. So we're going to give him the opportunity to give us some welcome. And after the welcome, we will... I will give you an idea of what you can expect tonight. We have a great program set up for you. And the main purpose of this is to really dispel any myths, fears, or hesitation that anyone may have regarding the COVID-19 vaccination, but in particularly the communities that have been hardest hit by this, which is obviously the Black and Brown community, the African-American community, and Latinos. So with that being said, let's kick it off with our chairman, Chairman Oz Nesbitt. Chairman Nesbitt, can you hear us?
I hear you loud and clear, Director Diaz, and hopefully everybody can hear me loud and clear. And want to start off by saying thank you to the Progressive Club, the leadership of Pastor Al Sadler and Mr. Lewis Carr for putting this idea together and partnering up with Rockdale Public Relations Department and our brand new community relations manager, Ms. Melissa Mims. I think this was a much needed conversation for the Black and Brown community, particularly here in Rockdale County, dispelling the myth and really encouraging folks that it is okay to take the vaccine and be a part of getting this vaccination so that we can get life going again and moving in the right direction. So I'm glad to be hosting this for folks here in Rockdale County that's listening, who were perhaps a little concerned or leery. We've got several professional medical people that's going to be coming to you this evening, giving you direct information about why this is a good move and a good thing, particularly for the Black and Brown community. So I want to just say this again. Thank you to the Progressive Club, Pastor Al Sadler, Mr. Lewis Carr, Melissa Mims, and the Community Relations team, as well as our Public Relations Department, Director Diaz. So I can't stay on it. I'm juggling 2 meetings tonight, but thank you so much. Thank you for thinking of Rockdale County, and I know a lot of you all are across the country tuning in and going to be bringing us some great information and resource, and we certainly do appreciate you here in Rockdale County. Thank you so much.
Thank you, Mr. Chairman. So folks, give me 1 second. Let me turn my camera back on so everybody can see me. And again, my name is George Diaz. I'm the Public Relations Director for Rockdale County, and we are so excited for this event tonight. Let me give you an idea of what you can expect. We heard from our chairman, but soon we'll be hearing about the mission, not only the mission of this event, but the mission of the Progressive Club in general. After that, you'll be hearing from our presenters. And as the chairman said, these have been presenters that we got thanks to Reverend Al Sadler and Mr. Lewis Carr. You have some of the best medical doctors in the country making time to speak to you specifically and answer your questions. So please send us your questions via Facebook, the Facebook chat or the Facebook Messenger on this post. And what we will do is towards the end, we will give Mr. Sean Kimball an opportunity to read these questions out loud so we can give our presenters an opportunity to answer them. But with that being said, let's move to our second portion of the program, which is the mission. And I would like to turn it over either to Mr. Al Sadler or Mr. Lewis, if they'd like to share a little bit of the mission of the event tonight and their organization. Gentlemen.
Well, Pastor Sadler, if you just give us a little bit about information about the Progressive Club. But our mission tonight, and I'll speak on that, is basically the premise of this program is not to persuade or dissuade anyone from taking any of the COVID-19 vaccines that are out there, but to present the science as it relates to the COVID-19 vaccine. And Pastor Sadler, if you just give us a little bit about the mission of the Progressive Club and what we do in the community.
Thank you, Mr. Carr. I want to say good evening to everyone. I'm just delighted to have this forum tonight. But just kind of briefly, the Progressive Club is not a political organization. We don't endorse political candidates, but we have been around since around 1956. And the purpose of the Progressive Club back at that time was be a liaison between the county government and the Black community. And I think even today we still are doing that. So I don't want to take up any more time. I just want to say thank y'all for being on here tonight. I hope you learn a lot of information. And thank you, Mr. Carr. Thank you, Chairman, and the rest of the Public Relations Department for Rockdale County. Thank you.
Thank you so much, Reverend Sadler. And before we go to our presenters, I believe we also have one of our current county commissioners who has joined us. Commissioner Doreen Williams, are you available to share a few comments before we get into the meat of the program?
I sure am. I've got my headphones on so I can hear it better. But good evening. I can't tell you how excited I am for this information. I think that it's valuable. I think we all need to listen carefully and really choose carefully on the decisions that we make about taking the vaccine. I've had mine, I've had both of them. I feel really comfortable, and it's almost a little freeing to know that I've had both those vaccines. So I don't want to take any more time, but welcome. I'm glad you're here.
Thank you, Commissioner. And one of the reasons why we wanted Commissioner Williams to join us is to let you know that you can get the vaccine and still be okay. She has gotten her second shot and everything as well thus far. And maybe a little bit later, she can share with us. I believe she has a town hall meeting coming up in mid-March, but we'll get to that towards the end of the program. With that being said, I'd like to welcome our first speaker. And if I'm not mistaken, I believe our first speaker will be Dr. Alvin Griffin. He will be sharing some community thoughts, pros and cons on the vaccine, concentrating particularly on Black and Brown communities. Dr. Griffin, are you with us?
I am. Good evening.
Good evening, Dr. Griffin. We will toss it over to you, and it's your show.
Thank you. Thank you for allowing me to be a part of this. We've done this before, and it's so much information, and there's a lot of misinformation that's out there. One of the things that we do realize is that this information or the facts change daily with this coronavirus. A lot of people, they know about coronavirus, but coronavirus has been around for years. This is nothing new. and how they came up with the name Corona, because it looks like a crown. That's why the name Corona. And then it's a disease, and it was discovered in 2019. So that's why they come with the name Corona, 19, Corona, COVID disease 19. So anyway, that's where we come up with it. So there are a lot of myths. You do have fever, you do have chills. However, if these things are severe, you need to seek medical help from your primary care doctor or a facility, because you don't want this thing to spread like wildfire, which it can do, because there is no cure for this. We can treat it, but we treat it with the symptoms. One of the things that we can do is basically eliminate the type of spreading that it is, which is respiratory droplets. And basically, once you get the symptoms, you actually should get tested. Now, a lot of people basically don't want to get tested because they don't want to find out if they do have the disease, because that actually puts the stipulation on whether they can move, whether they can work, whether they can take care of their family. So there's some other myths about even knowing whether they do have the disease, thinking it's going to go away, shortly. So there are two types of transmission. There was one directly, which is large droplets, and there's the indirect transmission from touching remote controls or breath droplets or park fountains, these types of things, or cell phones. So basically, there's so many different ways you can contact this, but we try to minimize the spread. I'm also director of one of the state youth detention centers, and a lot of these kids come in there with the virus, and they are unaware that they are actually ill. They don't even have any symptoms, but they actually are large or huge spreaders of the disease just by being closely in contact with other people. And so when that happens, we actually have to isolate an entire wing and not let any transmission come even with the adults while they're in there. So there's some concern about the school system being open. How safe is that? Most of the kids are asymptomatic. However, they go and they can infect adults who actually are asymptomatic, but they're more susceptible to this disease. So that's what the fear is right there. There's so many things that I could talk about, but I want to be limited to my discussion because I want to open it up for questions. And actually, I think we can do better if we actually find out what the people want to hear instead of us just getting a litany of information that's out there and no one can carry anything back from it. So that's basically what I wanted to say with the introduction. So if anyone wants to chime in, I feel welcome to any other discussion.
And Dr. Griffin, real quick before we get to the questions, would you like to share with us where you are zooming in from and what part of the country you're in? Are you in Georgia?
I'm zooming from my office in Rockdale County, Georgia.
Perfect. Well, it's good to have a neighbor here. And Sean, have we gotten any questions right now through the Facebook that we can bounce to Dr. Griffin?
No, sir, we do not.
Okay, thank you so much. And we will, folks, I'm sure as you hear more topics, if there's any questions, feel free to drop them in the chat.
Okay. I just got one in, Director Diaz.
Okay, why don't you read that for us, Sean?
From Coco Williams, can you get the virus from the shot?
You can get the virus from the shot. Actually, we're giving you the disease process so that you can develop antibodies to it through your own immune system. So you will feel sick. In fact, when I got my vaccine, the first time I was fine, but the second shot, I felt as if I had flu symptoms, and that only lasted for about 12 hours. After that, I was fine. So basically, we're putting it inside your body so that your body can produce, I guess, an immunity to, if you are infected with disease, you will have some protection with that. And one of the other doctors can chime in if they have something to offer.
Well, you know what? Just for a point of clarification, and maybe it'll come up during my discussion, because you did talk about potential side effects. So tell you what, why don't I present this? Perhaps that caller or that question, we can revisit it towards the end.
Sounds great. Sounds
okay.
great. And
I'm going to try and share my screen with you.
Okay. And Dr. Word, can you please share with us a little bit where you're zooming from?
Okay. Oh, this worked under practice conditions. What happened? Oh no. Oh, here we go. Can you see everything now?
Yes, we can, and we see
okay.
that it seems like you're coming from Houston, Texas, right?
That's right.
Great, great. And let me share, folks, a little bit. You're going to be talking to us a little bit about the myths and the science behind the truth. So take it away for us, Dr. Word.
Okay, now my focus is really going to be on COVID-19 vaccines. And this photograph that you see up there, what I'd like you to really focus on are those little red spikes, okay? Those are the spike proteins, and because they become very important in a while. I think Dr. Griffin talked a little bit about coronaviruses, and essentially they're a type of virus that's usually found in bats, but they can infect humans. There's only 7 species that actually cause disease in humans. 4 of them usually cause common cold. One of the 3 that caused more serious disease was SARS-CoV, and that was responsible for an outbreak in 2003. That actually was a pandemic also, but it only affected 8,000 people, but it was in 26 countries. There haven't been any cases since 2004. The next one is called Mariscoby, or it's Middle East Respiratory Syndrome. That was identified in 2012, and is pretty much limited to the Middle Eastern or the Saudi Arabian Peninsula, but it still has some cases there. And then finally, we had SARS-CoV-2, which is a causative agent for COVID-19, and that was isolated in 2019. Now, this next slide here, if you can look at it, what I really wanted you to emphasize here is I just wanted you to look at the first group of looks at infections, and next looks at how many people have symptomatic illnesses, and the last one is hospitalizations. And then that's by age group. And one of the things that you see striking is this big green bar here. Well, guess what? Those are in 18 to 49 years of age. They have more of the infections and they develop more symptomatic illness. However, when you take a look at who actually was hospitalized after they get infected, you'll see it's the individuals between 50 and 64, and definitely those individuals who are 65 years of age and older. In addition to looking at those age groups to see who's infected and all, people began to notice that there was some racial and ethnic disparities, and who was being infected, who was being hospitalized, and ultimately who was dying. And if this is a slide here from the CDC, and if you look at on the side here, it looks at the number of cases, the number of hospitalizations, and then finally deaths. And what it is, it's looking at 4 groups of individuals: Native and American Indians, Asians, Blacks, and Latinos or Latinx individuals. And what you can see, and it's comparing the rates of what are the odds or how more frequently do they get infected. Well, you can see here, it's almost twice the amount of cases in Caucasians. Not as many here and with the Asian population, but Blacks, it's 1 in almost 1.2 times. And then when you look down at Hispanics, the number of cases, it's much higher. What really is striking is when you get down to the hospitalizations. Look, Blacks almost 3 times more hospitalizations as Caucasians. Latinos almost 3 times. And then when it comes to death, you can see where the highest rates are. So basically what you're seeing, you're just seeing that disproportionate or discrepancy. The big question is why? And I don't have all the answers for it, but it's probably multifactorial. Some of it's related to socioeconomic status, some may be related to access to healthcare and or exposure to the virus related to their occupation. You have many individuals, particularly who are Latinx or Black, who work in the front line or essential workers, and the majority of them are not staying at home. They are going into the office to work. I think you've all have heard how you prevent it, because as soon as one of the things that Louis Pasteur, a famous scientist, said, if you can't treat a disease, your next thing to do is try to prevent it. And one way to do it is by developing vaccines. But in the meantime, we were told to socially distance, avoid crowds, wear a mask, etc. I think you're all familiar with things that are on this slide. But lo and behold, December of 2020, 2 vaccines were licensed, one by Pfizer and the other by Moderna. And when you take a look at that, about 70,000 people were studied between the 2 vaccines. The big difference between these 2 vaccines are, one, the Pfizer vaccine is really indicated for individuals who are at least 16 years of age and older, where Moderna, you have to be at least 18 years of age. They both require 2 doses to work effectively. The Pfizer vaccine has to be given 3 weeks apart, whereas the Moderna is 4 weeks apart. But the biggest thing is that look at the efficacy. And what they started off in their study was they said, well, tell me, after I give you 2 doses of vaccine, and I want to see what are the chances are that you're going to get COVID vaccine 2 weeks after I've given you the vaccine. And when they took a look, it protected 95% of the people in the one study and 94% in the other. So that was better than anyone had imagined. And most importantly, there were no safety concerns that were identified. The most common side effects are listed on this slide, and Dr. Griffin alluded to some of them. Discomfort at the injection site, tiredness, headache, muscle pain, fevers, chills. And for many individuals, it seems as if the second dose is the one that when they tend to have or exhibit these side effects more often so than in the initial dose. So then you have to ask yourself, well, what's the benefit of the vaccine? Well, one, it's going to eliminate your risk of getting a COVID death, because if you get infected, you can't die from it. It nearly eliminates your risk of being hospitalized, and it also will reduce your ability to infect somebody else. And also what appears to be, and this is preliminary data is coming out, it seems to be highly effective against some of those COVID-19 variant strains that have been out. So then you say, well, this next slide here really takes a look at, this is from the Kaiser Family Foundation. So you say, well, okay, everybody's waiting for this vaccine. Aren't you ready to get it as soon as it's available? Well, they did this survey in December, and you take a look and you'll see, the question was, if this vaccine was available and it's free, what would you do? And you see a third of people, they were ready to get it as soon as it came out. Almost 40% wanted to wait and see how it's working. And then we have 15% who definitely are not going to get it. And then another 9% only if required. Now you did see some movement, some change once the vaccines were available and people started receiving them. And now you see the people in January, it went up where it was 34%, now it's 47%. Now in December, when they asked this question, the vaccine wasn't available yet. But now in January it is, so now we have 47%. The numbers that have diminished are those who are waiting to see how it works. The thing that's a little disturbing is that we still haven't changed, people who definitely don't want to get it or only if it's required haven't changed significantly. And a slide that I haven't shared with you is that most of these individuals, unfortunately, are Black and brown citizens. And those are the groups that are being disproportionately affected by the disease. So then you ask, well, then what are the reasons for not getting immunized? And 4 big categories come up. One, there's concerns about side effects and the vaccine safety. Well, there wasn't anything really identified, but people said, oh, well, that's not a lot of people. So then what the CDC did was there's a vaccine, it's called VAERS. It's a reporting system that you can just call into spontaneously if you want to. And they took a look at it from December, for a month, from December 14th through January 13th. Now, that was based on almost 13.8 million doses of vaccine had been administered in the US. And about 10% of the individuals had complaints. And when they took a better look at those individuals, you'll see what the top 3 were. Headache was 22%, fatigue 16.5, and dizziness 16.5. Another group that I'll share with you is about another 1 million individuals through a program called V, like Victor, V Safe, that the CDC is monitoring, and you can sign up for V Safe when you get your vaccine. And what they do is they send you out a text daily to sort of like a diary to find out. They want to know, well, how are you feeling as you go along? And when they did theirs, with those 1 million individuals, they found the most common side effect was discomfort at the injection site. So again, between all of those individuals, and that's about 14 million doses just in that first month, there were no surprises, and that was reassuring. A lot of people felt that the vaccine was developed too quickly. That's why they don't want to get it. Well, the two vaccines that came out initially was they used a somewhat different method to deliver it. You keep hearing about these mRNA vaccines. Well, the thing is this, that process itself had been being worked on and studied for over maybe about 10 years. So it's not new. And so this happened to be the right time and the right virus for it. The other thing too is that you have the entire world. You have government, you have industry, you have people who do research at universities. Everybody is working simultaneously and together in order to try to develop something. And that's where you saw vaccines. There were partnerships between, say, the people down at NIH and another company, Moderna. But that technology, they had been working on that for well over 6 or 7 years, so it didn't happen overnight. A lot of people see, I want to see if it's safe, and so they'll receive it later. Quite honestly, I'm not sure how many more people have to have it. We've given about 58 million doses in the US already, and a lot more around the world. The last group say they just don't trust the government. Some of it may be related to prior studies that the government was involved with. Most people, particularly Blacks, will refer to Tuskegee study, but the challenge, or should I say the difference between this Tuskegee study and this is that in the Tuskegee study, they actually knew that you had something wrong and they deliberately didn't give you anything to try to treat you, just to see how the disease progressed. And as a result, there were a lot of changes on how the studies were conducted. In this situation, it's not that they want to hold anything back from you, but they want to give you something to try to prevent you from being infected, being hospitalized, and ultimately dying and or having complications. So vaccines are available. Take a look. Let's just see how your county, Rockdale, is doing with the distribution. This slide here is from the state of Georgia. You've administered about 14,000 vaccines. But now let's take a look. Statewide, you had about 2 million shipped there, of which 81% were administered. And this is data as of today. Now you take a look at the recipients. Now I don't know what the demographic is of your Rockdale County. However, when you take a better look at it, and when you look at the recipients by state, by race, you will see that I'm sure there's this proportion of African Americans in your state is much higher. When you take a look at ethnicity, you can see what percent have identified as Hispanic. So again, we're seeing some disparity in how the vaccine is being administered, and they are trying to address that because they're seeing that come up too. Right now, who's a candidate for COVID-19 and vaccine? I mean, nationally, they recommend anyone over at least 65 years of age and older receive it, or should I say 65 years of age or 16 years of age with certain medical conditions, but each state is somewhat different. Georgia right now is limited to healthcare workers. That is not limited to physicians, but that also includes nurses, laboratory technicians, any environmental services, anybody who's in that hospital will have contact with patients are eligible. Right now, you're only doing individuals who are at least 65 years of age and their caregivers, which is good. Residents and staff of long-term care facilities, law enforcement is in your list also, and fire personnel, including the volunteer firefighters, as well as your 911 dispatchers. Later on, this list here just lists individuals with certain medical conditions who are at a high risk for developing severe COVID-19. And once your state goes into that mode, these other individuals listed on here. You can see that it's probably going to expand the numbers because obesity, severe obesity, individuals who have heart conditions such as heart failure or cardiomyopathy, which is a sort of an enlarged floppy heart. And there's people who have coronary artery disease. Anybody who has chronic obstructive lung disease, you hear people say COPD. You see people with pregnancy, sickle cell diabetes. And now under the immune compromise, right now, the only one truly listed under there is considered a solid organ transplant. The last two things I like to mention that while we all know what the direct effects of COVID-19 have been, there are many indirect effects. Two big ones because I do infectious disease. And so I like vaccines and I like to prevent diseases. One has been the decrease in both the US adult and in childhood immunization rates. If you look at the adults who are not getting their pneumonia vaccines, not getting a tetanus booster or a shingles vaccine, it's down by about 60% compared to the same time period last year. Childhood immunization rates had also dropped significantly also. They start getting them back. They're trying to get those children back into the office because the concern was that we'd have an outbreak such as measles because immunization rates would get too low. The other thing that may happen here are people are delaying or avoiding medical care, including elective surgeries. Dr. Carr is going to talk a little bit more about elective surgeries and when you can safely have them afterwards, after you've had COVID vaccine. And finally, the last thing I was going to talk about is some of the other communicable diseases have taken a big hit because so much has been directed towards COVID. And one is on the tuberculosis prevention programs and treatment programs, because a lot of resources within the health departments have been directed to COVID. So they haven't, I'm not saying they're non-existent, but they don't have the resources that they once did. The last slide I'd like to leave you with is that one of the things it's key is to have a good resource. You can get great information, you can have misinformation or disinformation. The disinformation is somebody who sets up a site and deliberately is telling you something false. You're in the backyard of the Centers for Disease Control. That is a fabulous website. It's very user-friendly and it's updated and has tons of information. For your state, it would be going to the Georgia Department of Public Health, and their website is there also. The third place that I loved, finally, is that I finally found a number for people who need to schedule for a COVID vaccine and are not computer savvy. This line is up and running. This number, they're open Monday through Friday from 8 to 8, Saturday to Sunday. From 8 to 5. I'm sure majority of people who might need to utilize this probably won't know this, but hopefully you can get that number out. But someone is there to assist, and a lot of our seniors do not have advocates and are not computer savvy at all. The last thing I wanted you to just remind you of is to be safe if you decide to get vaccinated, and I hope you do. That's the website for that. But even when you go to get your vaccines, that's in your packet of all the information to read. There is information there about it. So I'll thank you for your time, and I think Dr. Carr is next.
Thank you, Dr. Word. And Dr. Carr, before we get to you, I wanted to throw out a few questions that we've gotten so far in the chat. The first question we have is from Erica Thornton. And she says, please clarify if a person comes in contact with a confirmed case, how long should they quarantine? And whichever doctor would like to answer that, please go right ahead.
Okay, I'll take that one.
Okay.
You can look at it two different ways. One, if you opt not to be tested at all, then you need to be quarantined for 14 days, okay? If you are tested, ideally, you should not get tested till at least 4 or 5 days, because just because you're exposed, if you go out too quickly, you may not have had a chance to become infected, okay? And so give yourself a chance to see if you become infected. And if you test negative, say you go day 5, you test negative, or day 4, you test negative, then you can, and you remain completely asymptomatic, then by day 10, you can go back and do whatever you like to do, okay? If you test positive, that's a different story.
One of the questions that I get often is, when should you get retested? And do you have false negative and false positive tests when you're retested?
Okay. One of the things is currently now it is definitely not recommended to retest at all, unless 3 months have gone by since you first tested positive. What happens is sometimes you might have a little of the virus still present, and so then you get you'll get what we call a false positive test. So that's why isolation now, or going back to work or school, is based on your symptoms. It's no longer based on whether or not you have a positive or negative test anymore. So you don't retest at all. Now, go ahead.
No, I'm sorry, Dr. Ward. Go ahead. I have another question after you're done with your comment.
Okay, and the other thing is, I think it's important to pay attention to what type of test you're getting. The PCR test is going to be your gold standard, okay? If that's positive, it's true. Okay, you'll see people doing an antigen test. The antigen test only checks for a couple of the proteins, not all of them. And one of the downsides is that test is really not a good test for somebody unless they have symptoms. Okay, if they have symptoms and it's in 4 or 5 days, and if they test positive, then it's fine. But if they go completely asymptomatic and they do an antigen test and then they come out negative, they have a chance of having a false negative test. And there was an outbreak of a girl who infected about 15 or 16 family members. 3 different families went on vacation, and she took her test, and she had a negative antigen test after being exposed. But that wasn't she shouldn't have had that test anyway.
Okay,
So
great.
That answers your question.
And here's the next question, and it involves a statement and then a question, and this is from Coco Williams. The statement is, and I'm believing that she's submitting this as a question, but I'll read it as she typed it up. I won't need to wear a mask after I get vaccinated for COVID-19. And then it's followed up by, how can we help our seniors register when it's almost impossible to register if you don't have a computer, cell phone, or access to the internet? Then you have to be computer savvy. It's hard enough. A lot of seniors don't have that capability. And doctors, before I turn it over to you, I'm going to try to take a stab at some of this so we can still leave some time for Dr. Carr. When it comes to the mask, from everything that I've read and have seen so far, I think the medical community is still recommending that you wear a mask after you get vaccinated for COVID-19. And also, Dr. Word just shared a telephone number that is a hotline where folks can call if they don't have access to a computer or do not have familiarity using the internet. They can use that, and that will help them identify how to get their vaccination. And towards the end of the program, I will also ask Mr. Sean Kimball to share his screen and walk us through the county website to show folks how to get to the COVID-19 tab that has a lot of this information and resources. And Dr. Word, if you're able to email us your PowerPoint, we would be glad to post it on that COVID-19 tab, along with any other resources or information any of the other doctors have. Doctors, is there any objection to how I responded to the mask question and the accessibility for senior citizens to register, or anybody who doesn't have access to internet?
No, not for me. I
Okay,
think you were
great.
listening.
Great.
That's perfect.
Now we have another question from Miss Michelle McGee, and I will also try to take a stab at this to keep us moving. Her question is, so the vaccine will definitely keep you from getting COVID. And here is the thing, I don't think anything can give you 100% assurity when it comes to the medical field and these types of treatments, because number one, everybody's body responds differently. However, what this vaccine will do will help, will greatly increase your chances of, number one, hopefully not getting sick. But number two, if you do get sick, to get over this illness quicker and hopefully not as painfully. Doctors, any objection to that? Did I miss anything?
No, I don't think so. For the two that are the two that are being utilized right now, I mean, as I said, it was 95%, and as you said, that's not 100. It's 95. Perfect. Okay. Perfect. We have the J&J will be formally reviewed on Friday, but you're hearing some information about J&J that's been leaked out already, and what it looks like is that one of the things that has prevented is 100% of hospitalizations and deaths. They had 0 occur. So I think you can stay tuned to that. But as you said, 95%, nothing's 100%.
Perfect. Thank you, doctor. And I'll ask one of these last questions, because if I don't mention it, I am sure I will get in trouble, because this is from my mom, who is watching us on Facebook. Hi, Mom. She wrote, wow, the school is open and they haven't received vaccine. How are we going to protect our teachers? Well, Mom, before I toss it over to the professionals, one of the things I will say is, I believe within the last 24 hours, and if it possibly might have been even earlier today, Governor Kemp, which is the governor of our state of Georgia, has released his intentions and the plans to move up teachers in the pecking order, and folks who work in schools to be able to participate and get the vaccine. But doctors, do you know anything different to that, especially the doctors that may be in Georgia?
My wife is a school teacher, and there's a lot of apprehension in the schools as far as the teachers and the workers being exposed. For the past, I guess, 5 months, they've been teaching remotely. However, some of the schools have gone back and they've done fairly well, but there are other schools who have not gone back and don't plan to go back until next year. So the jury is still out as far as what is safe and what is not safe. And there's a lot of anxiety with the teachers, because the kids, a lot of them don't even know they have the virus, and they actually are not being tested when they come into the buildings, even with their temperatures. So that's a concern. I know at the detention centers, we do test the kids before they come in, before they enter the facility. So if any of the other doctors want to chime in on that, I'd love to hear what they have to say.
And doctors, before we give you an opportunity, I do see a hand raised by one of the folks that is joining us on Zoom, and I believe that's Commissioner Dr. Doreen Williams.
Okay.
Dr. Williams, did you want to add a comment before we toss it to the doctors again?
Yes, I just wanted to say that Governor Kemp did in fact announce this afternoon that he's expanding the eligibility for the vaccine to include teachers pre-K through 12 and adults with intellectual and developmental disabilities and their caregivers. And that all begins on March 8th.
Okay.
Perfect. Thank you so much, Dr. Doreen Williams. And I will mention, she is a doctor. She is not a medical doctor. She is a doctor with a PhD in education that also serves as our post 2 commissioner for Rockdale County. Mom, I hope you were happy that I asked your question. And now I'll toss it to Dr. Ward to finish up any remaining questions, and then we'll go to Dr. Carr.
Just two quick comments. One with the school, and it really there are a few states that are starting to prioritize teachers. However, what I do understand the rationale of why CDC has said that going into the schools, particularly if you can help isolate individuals, keep them 6 feet apart, assure that they wear masks, because when if you look at how many cases were occurring per 100,000 children, when they compare to children who are in school versus children who were being isolated or virtual, it wasn't statistic. It was like, say it was like 411 per 100,000 cases versus I think it was like 414. Don't quote me on the exact 400 and something, but there really wasn't much difference. Now it is a more challenge to transmit it, or should I say to adhere to things when you have a larger school system versus like they had a school system in Wisconsin, and Wisconsin, they cut their schools classrooms down. They were 6 feet apart. It was mandatory they wore masks, and everybody wore masks. Nobody got sick. Okay. Now you just had an outbreak, I know, in Cobb County, and that was in the MMWR. And when they took a look at that, I think 31 people ended up getting infected from maybe about 6 schools, I think it was. And it turns out that some was teacher-to-teacher transmission, and then subsequently infected children. And then there was about 4, they weren't sure if it was the child who gave it to the teacher who introduced it in. But that's why they feel, I mean, I think it's great that the teachers will get it, but that was part of the rationale, is because that wasn't the group. If you want to look at a group of individuals where if they get infected and then you see disease follow, that's 18 to 22. Find a college town and you will have an outbreak shortly thereafter. And about 60% of these young people live with their parents.
And Miss Mary Jefferson, we know that you're streaming us, and I just wanted you to know that we did get your question, but we will ask your question after we give an opportunity for Dr. Carr to present. Dr. Carr will be talking about the science behind surgeries and other medical conditions after COVID. And Dr. Carr, if you will share with us where you're streaming from, and we will toss it over to you. And okay, and I was just going to ask Dr. Doreen Williams to lower her hand, and it looks like she has. So Dr. Carr, you're up to bat.
Yeah, my name is Ken Carr, and actually I'm a native of Conyers. I went to the school system there. I presently live in California in the San Francisco Bay Area. I'm an internal medicine doctor, but what I do now is I specialize in people going to surgery. I know this is a little off topic than the vaccines themselves, but what I want to do is sort of educate people that if you get COVID, you just can't go to surgery safely. So, you know, if your doctor or a surgeon says, okay, next week we can have surgery, but you've had COVID a couple of weeks ago, I want you to be an educated group to say, no, doctor, we need to think about this before you take me to surgery. This is actually a lot of new literature that's been out recently. I work for a really large medical group, and we came up with our own guidelines, but I'm actually going to share the guidelines from the Anesthesiology Association. And hopefully I can share my screen here. Let's see. Give me one. Am I sharing it or not?
I don't believe we see it just yet.
Okay.
And we'll see if maybe we have to, and Sean, make sure that we have any permissions that we need to let Dr. Carr have if he'd like to share his screen.
Yeah, man.
And Dr. Carr, it looks like the permission is open for you to share your screen.
Okay. I just got to find the PowerPoint. There we go. All right.
Okay,
you got it?
perfect. Yeah,
Okay.
it's coming up. You got it.
As I said, I am a Rockdale native. I do live in the San Francisco Bay Area, and I do try to get home as much as possible. And I do specialize in peri-op medicine. So here's, let me change this to presentation here. So the big question is, when can I go, hey doctor, when can I have my surgery? As I said, it is something that's definitely super important. And again, this is from the American Society of Anesthesiology. So it is a very reputable group. And they had a subgroup that they got together and they came up with these present guidelines. So these guidelines are intended to aid the surgeons, the hospitals, the anesthesiologists, the physicians, as well as the patient as to evaluating when you can schedule surgery post-COVID. So again, I'm talking specifically post-COVID. So when is it ready to go to surgery post-COVID infection? In general, all non-urgent surgery should be delayed until the criteria are met for discontinuation of isolation. And Bonnie and I can talk a little more about that later about, she talked a little about when you can come out of isolation. And also when patient has met the criteria for recovery from COVID. So once you get COVID, you have to recover from it. The complications of COVID: pneumonia, blood clots to lungs, legs, death, strokes, heart attacks, and kidney failure. Those are a lot of things that you really don't want to have. COVID is not like a regular, cold virus or flu virus. It starts to affect a lot of things. And one thing it does affect, it starts to affect the clotting system. Okay, so before we can decide, when you go to surgery, we have to decide what level of COVID did you have? How bad was it or how not bad was it? If you have mild COVID, this is when you get the muscle aches, fevers, cough, sore throat, pain, tiredness, basically all the things that Bonnie talked about initially. But you cannot have any shortness of breath or have any abnormalities on your chest x-ray. So if you have mild illness, you're basically presenting with just, my muscles hurt, backache, fever, sore throat, tired. You can have a little runny, stuffy nose, but you cannot have any what we call respiratory issues, cough or sputum production. Moderate illness. This is when you have COVID, you're getting pneumonia or bronchitis, and you actually see it on chest x-ray. And I know everybody out there is buying the oximeters or the oxygen monitors. So if your oxygen saturation has to be greater than or equal to 94% on room air. The third form of COVID illness is these are the people that basically go to the hospital. We call these the patients with severe illness. The respiratory rates greater than 30, the oxygen saturations less than 94% on room air, and they do have a pretty significant pneumonia on the chest x-ray when we do x-rays on these guys. Now we've looked at the three different types or classifications of COVID. Okay, now when can I go to surgery? When can I get my elective surgery? When can I get my knee replaced? When can I get my plastic surgery? Those are things that are important to people. So if you're basically, if you were asymptomatic or had very mild COVID, you can go to surgery safely in about 4 weeks. Again, remember, these are people that had no breathing issues and only had mild symptoms or no symptoms. So if you want to get a knee replacement and you have a little mild COVID, if you recovered greater than equal to 4 weeks, you can go to surgery safely. If you had a cough, fever, shortness of breath, and you did not require hospitalization, right now we're saying that after 6 weeks, you can go to surgery. So you went from 4 weeks to 6 weeks now. Again, what's happening is we want the body to basically recover from the COVID infection. Now, 8 to 10 weeks, if you have diabetes or if you're immunocompromised or you needed to be hospitalized for your COVID, we're telling people that you can safely go to surgery 8 to 10 weeks after the onset of symptoms of your COVID. And these are the really, really sickest people. If you needed to be admitted to the ICU for your COVID infection, you really should not go to surgery until at least 12 weeks, post-COVID. So basically what I'm just said is that if you got COVID, you are going to have some complications or risk factors for post-COVID issues like pneumonia, strokes, heart attacks. And if you're going to have an elective surgery, you want to be as safe as possible. So those are the present guidelines that are out there now. And basically, as I said, it's there for you as patients and as citizens to understand. You just can't go to surgery immediately after. If your surgeon is not aware of these, please make them aware. Okay?
And sorry, Dr. Carlos, having some technical issues there. And it sounds like that was the end of your presentation. So
yes, it is.
If you don't have any objection, let me go to Mary Jefferson's question. And her question is, I saw something about RNA. I know that DNA is made of the product is a single strand of, and forgive me for butchering this, ribonucleic acid, RNA. The RNA can travel out of the nucleus into the cell where it is used to make protein that the cell requires. So what does the color of a person's skin has to do with determining if a person has contracted the corona-19 virus? I'm not sure if I quite get that question. Doctors, is that something we even need to address?
You're muted, Bonnie.
Okay. Okay, the two vaccines that are out are called messenger RNA viruses. I mean, they're the way it's called an mRNA virus, and that's a new technique. Okay, I'm not sure what the person is alluding to when she talks about color of skin and COVID. Okay, I'm sure I just don't understand. But a lot of people keep hearing these are RNA viruses, and how do I get it? What happens is that you take a RNA. You have to have a way to get that spike protein I told you about. You want to make it. Every vaccine has something to carry it. The virus or whatever that they're trying to make antibodies against in. Now, in the COVID vaccines that we have now, there are no live viruses in it, okay? There's no COVID virus in that. So there is the RNA in there, and it's going to make the spike protein. So once, and they put it in a piece of a fat molecule. So they call it a lipid molecule. So it goes into the fat, you get injected, and once it gets injected, then there's some cells right there that says, hey, let me absorb this. So it does, and then that RNA starts making spike protein. And then all of a sudden, the body says, we recognize this as foreign. So now I'm going to make antibodies against it. And so they do. And so, but you've never gotten any of the coronavirus vaccine. It doesn't go in to affect your DNA at all. It's just at that spot there. So when you are potentially exposed to it, then you're able to call up those antibodies, they'll recall it and be able to fight it. You can look at it like one friend of mine said, well, can't you use an analogy like it's the military? Okay, you got some soldiers, you got them prepared, and now when the enemy comes to attack, your soldiers line up and come out. They've just been, hiding and waiting for them to come. I don't know if that made sense to you, but basically, there's nothing related to the color of your skin, and you do not get a virus in you, and it doesn't affect your DNA.
Perfect. Thank you so much, Dr. Ward. I believe, if I'm not mistaken, those are all the presenters that we have. And Sean, I do not see any additional questions that have been submitted, but if you have something different, let me know. And Dr. Word, it looked like you had something additionally you'd like to add?
No, I think I did say it. I just wanted to make sure the person didn't think that they got live virus. When you have those symptoms, it's your body reacting to recognizing something as foreign. So basically, you're responding to appropriately, as saying your immune system is working very well. And most people get better. You can take some Tylenol, some ibuprofen, if you have those symptoms, but you don't take them prior to. If you develop the symptoms, take them.
Hey, Bonnie, talk about the post-vaccination isolation or whatever, post-vaccination.
Oh, that's right. Yeah, because now that comes up. Now people are getting vaccinated. If you previously, if you were exposed to someone, if they have been if you have been adequately vaccinated, by that means you received both doses of your vaccine and it's been at least 2 weeks since you received those vaccines. If you are exposed to someone and it's less than 90 days, there is no need for you to quarantine at all. Okay.
Perfect. Sounds good. Sean, so it looks like we do not have any additional questions. In the meantime, Sean, what I'm going to ask you to do is if you will share your screen and maybe walk us through the website and show folks starting from the home page, going straight to the home page and maybe reading to them what the website is and then showing them how to get to the COVID-19 tab. So Sean, take it away.
Okay, the website for Rockdale County is www.rockdalecountyga.gov. Once you get to that site, if you scroll down, this is where all our news is. Anything going on in the county is usually here. Specifically tonight, we're talking about the COVID-19 coronavirus. If you click on that, of course, you can get tons of information there. What is COVID-19? What are the symptoms? How do I protect myself? And there's a tab right up here at the top. As you come to this page, let's click here for the latest COVID information. This is information that is collated by our emergency management agency, and it covers pretty much any information you want to know about what's going on locally, such as that recently our site moved from one of the school systems because the school reopened to Springfield Baptist Church. There is another piece on here. We're still in 1A plus. There is a number that you can call for getting. It kind of gives you a message to let you know when vaccines are available to get vaccinated, to basically make your appointment. And you basically get text this number. I'm trying to find the number right quick. But you text the number and it will ask you some questions and you respond to those questions, and it will then set up a time to let you know when there are vaccinations available in your area. I'm doing this on the fly, so give me just a second.
And folks, as Sean is looking up that number, the main thing we want you to know is please, please, please know that there are resources. There are resources to answer your questions and resources to be able to educate you and resources to help you get what it is that you're looking for. So again, don't forget rockdalecountyga.gov, and then you can go to the COVID-19 tab, and you will have not only all this information that Sean has shared thus far, but a lot of other resources. Sean, it looks like you found the number.
Yes. So if you text the word VAX, VAX, to 1-844-554-4024, like it says here, it'll ask you a series of questions about which county, eligible phase, etc. It will then send you a text message when a vaccine site has opened their appointment calendar. That doesn't mean you're going to be you're scheduling it. It's just helping you to identify when the calendar is open and has spots available. So that's a big part of it. And of course, as Dr. Ward spoke earlier, she showed an image from dph.georgia.gov. I work on a weekly video called the Weekly COVID Report, and I get all my information from that website. And what she showed was the recent vaccination charts that they have placed on that site. It also gives you daily COVID numbers for what's going on in Rockdale County, as well as statewide. And I think that's about it, Director Diaz.
Perfect. Yes. Thank you so much, Sean. And if you all will bear with me 1 second.
I've got one more question I'd like to ask the other doctors.
Yes, please go right ahead.
I've been getting a lot of questions about exercise and mask wearing. And I get two schools of thought about that. And especially with the spring season getting ready to come and everyone is put on this COVID weight that I see in my office, they're wondering, should they wear their mask during exercise or not wear their mask during exercise? So I'd like to get you all's opinion on that.
I guess, Dr. Griffin, it would depend on where they're exercising. If they were out just running and, staying at a distance from other people, I don't see where they need a mask. But I would always carry one with me because you never know when you run into a friend. I mean, I do that when I ride my bicycle. I just carry a mask with me because I have run into friends while I'm out. If they go into a gym, I think right now it's still not recommended, and I know some people have to do it, but I don't know how they're socially distancing. That is a closed environment. And so if they went in there, if they're leaving their isolation bubble, as you would say, I would always wear a mask. And actually now many people are double masking. The only time you don't need a double mask is if you're wearing the N95s.
Because the reason I asked, because I read one statement is basically saying, do not wear the mask because it impedes your ability to breathe comfortably. However, you're making other people vulnerable if you may have something, if you actually do exercise, and you may be infected. So I just wanted to get you all's opinion on that.
I agree. If you're going to be exercising outside, isolated, you don't need a mask. And it does make it uncomfortable if you're running and trying to breathe in a mask. I wear an N95, but if you're inside, you definitely should wear the mask. And, and also they found out that loud singing in churches is definitely one of the biggest spreaders. So you think singing is one thing, but exercising, you're definitely putting out more particles.
Mm-hmm.
Okay.
Dr. Griffith, if they sell these things, they're like tortoise shells that you can just buy. They're very inexpensive, and you can put that underneath your mask, and it's very comfortable, and it elevates it so it doesn't fall straight on you. I don't have mine here with me, but I did get one, and it does make a world of difference if the way they're fitting.
Thank you. Mm-hmm.
Thank you so much. And quick, let me look at here. One question. This is from Monica Clay Glenn. Just want to be clear. Is the virus in the vaccine? And then she follows up. So if you're vaccinated and exposed, you don't have to quarantine if within 90 days of that vaccine. That is, excuse me. So two different people. The first question was from Miss Monica Glenn. The second question was from Miss Michelle McGee. And let me repeat them both just to avoid confusion. The first one is, just to be clear, is the virus in the vaccine? Doctors?
No.
Okay, perfect. So we know that the answer is no. Now here is the second question from Miss Michelle McGee. So if you're vaccinated and exposed, you don't have to quarantine if within 90 days of the vaccine?
And it has been 2 weeks since you received your vaccine.
Okay.
Because it takes 2 weeks after you receive your vaccine for it to become effective. So
Okay.
if you're in that, if 2 weeks have passed and then you get exposed and it's less than 90 days, then no, you do not.
And we're using a 90-day window because that's really all we have right now. So you'll see that most things in terms of infectivity, vaccination, we're using the 90-day limit right now. And I want to reiterate again what Dr. Word said is that we do not repeat testing within 90 days. Maybe if you're immunocompromised, we will think about it, but definitely don't go back and get tested within 90 days if you're not immunocompromised. And that 90 days is probably going to go even further as we get more research into this.
Perfect. That is great. Let me get to the next question. Bear with me. Our next question is from Janice LeBlanc. And her question is, I would like to ask, I was just swabbed at school. The test swab, both nostrils, is that the best to determine if you have COVID?
Again, it depends on what test it is. I don't know if they had a PCR test or antigen test. Okay. If it's a
does
PCR,
it matter?
Yes,
Doctor,
it does.
does it? Well, I'm saying, well, I guess this is a question. Will testing the swab in both nostrils, does that determine if it's a PCR or?
Oh, no.
Okay.
No, that is the type of test. It is. One is PCR, and that is the gold standard. That can either be done by swabbing inside the nose, taking it going back through the nose, or with saliva. Okay. That's your gold standard. Some people do antigen tests. And so I don't know what type of test she had. There's no role for antibody testing at all, but I know some places do antigen tests. Again, that's a test that's really designed for people who are sick. Because if you can have a false negative test on an antigen test if you're completely asymptomatic.
But do they swab to do the antigen test is sort of the question. Do they swab for both PCR as well as antigen?
Well, they do, but she said, which test did I have? And she said, is that the question was it okay to do it in the nose? And it is, but I don't know which test she had.
Yeah, my question to you, Bonnie, is do you do both the antigen test as well as the PCR with a nasal swab?
You can do both with a nasal swab, yes.
Okay.
That's why I said I just didn't know which one they had.
And real quick, doctors, I love this exchange. One thing I did want to go ahead and bring to the attention before we continue with this exchange is that at this point, we're about 8:18. So we've done a little bit over an hour, but that doesn't mean we necessarily need to stop, but we will start working towards the wind down. And I did want to give this opportunity as an announcement as last call for questions. Last call for questions. And but in the meantime, if you have any questions, please submit them. And doctors, please continue that dialogue, and we'll see if we can address any additional questions within the next 3 to 5 minutes. But please continue your conversation.
Yeah, Bonnie.
Yes.
I understand that the antigen, the PCR test has to be negative before you can enter the country.
Well, the new regulations now coming into the U.S. is that you have to, and which is interesting to me that the U.S. is actually accepting an antigen test because, but anyway, you have to have a negative antigen test or a negative PCR 3 days prior to returning back to the U.S. after international travel. Now, why it's unusual for me is that all the other countries are requiring PCR to get into theirs. So why are we accepting an antigen? Now, some of it may be because I'm not sure why they accepted that. Sometimes it may be logistical because it's going to be hard for some, depending on the countries they're going to be able to find a test. But it is for 3 days. It's not exactly 72 hours, it's 3 days. Which is a big difference because some people are 72 hours. And depending on the flight, if you get that test when it's dated or it's stamped, they can't get into the country. But you're right, that's something new.
Thank you.
Sean, have we received any additional questions thus far?
No, sir, we have not.
Okay, great. So we are at 8:20. What we will do is, before we officially roll out and bring this to a close, we will give an opportunity for our speakers to give some final thoughts. And what I'd like to do is start again with our hosts. So Mr. Carr, Mr. Lewis Carr, or Mr. Reverend Al Sadler, any closing remarks on from you all?
Well, I would like to say thanks to all of the presenters. I appreciate them cooperating, especially my brother. I think everybody's done a fantastic job. I've really gained a lot of knowledge tonight, things that I didn't know. And thanks to my friend, Dr. Griffin. I appreciate you. I appreciate you, Dr. Word, and I also appreciate you, Dr. Carr.
Thank you.
It sounds like Dr. Carr might have had about the same amount of wiggle room that I had when it comes to making sure I put my mom's question out there.
How about
So it sounds like we're on the same boat.
Yes,
Dr.
sir.
Word, would you like to any closing comments for you, Doc?
Well, I just hope people will go to, people make decisions about being vaccinated and other things. Usually, most of the people get their information from their physicians. A lot of people get it from their friends. And so I just would hope you would just go to a reliable source. Like I said, you're right there in Atlanta. The CDC is a great source. For some people, if you like, blackdoctors.org has one. They're all, your new senator, he's part of a religious group. And I think it's called Healthy, I'm blanking on the name of it. I'll have to think of it, but it's something with Healthy Lies, but they have a big initiative and they're pushing all the churches. Atlanta is one of the target cities, probably because he's from there. But the main thing is just think about, get correct information. Today I had someone in my office, and just by the way, they just mentioned something and they said, they had COVID, the entire office had COVID that she worked in. And she said, I'm not getting that vaccine. I said, why? And she said, because there's mercury in it. I go, no, there's not. She said, yes, there is. She said, plus there's fetal tissue. And I'm like, where did you get this from? And so we went through what was in the vaccine. So that's what you call misinformation or disinformation that she's getting from her website. So I would just urge you to go to a reliable website to get information to make a decision. And that's all. And thank you.
Thank you so much,
Director
Dr.
Diaz.
Word. And, yes, sir.
Director Diaz, I've got a question in the chat where they're asking how are we looking with vaccinations in Rockdale County? Is it all right for me to answer that real quick?
Yeah, sure. And just please make sure that you source, tell us where your source is.
Yes, sir. As you see shared on the screen here, this is from Coco Williams. If you go to the dph.georgia.gov, for the Georgia Department of Public Health, you scroll down and there's a large square here, and it's called an interactive dashboard.
Mm-hmm.
If you click on that dashboard, it'll give you the up-to-date information for our area. And over to the top right here, you can actually scroll down and bring it to Rockdale County. Let's see. And it will actually give you current information for Rockdale County. So this should help you with vaccinations, what's going on, any questions, and the status report from at the beginning of the page when you first come into the DPH site. There's a status report that gives you daily numbers of COVID cases, COVID deaths, and so forth. So DPH is a great place to start to answer any of your questions like that. Thank you, sir.
Thank you so much, Sean, and thanks for catching that. Before we go to Dr. Griffin or Dr. Carr, I wanted to give an opportunity to Commissioner Williams. Would you like to add any closing remarks? And it sounds like she may be good for right now.
Yes.
But if you, go ahead,
Okay.
Commissioner Williams.
Took me a minute to get to the unmute.
Mhm.
Yes, on March 22nd, I'll be hosting a town hall meeting about grief and resiliency. We know that so many of us have experienced grief in some way or another. You know, many people have lost someone in their family or their friends, but we've also grieved over the fact that we've not been able to get together with our friends and even with our families. I have a 2-month-old grandson I have not seen yet because he lives out of state and we just haven't traveled to see him. So Dr. Tracy Lewis and Dr. Deidre Hawkins will be speaking. They're both clinicians and PhD kinds of doctors, and they are specialists in grief and in resiliency. And so I would invite you to join us March 22nd at 6 p.m.
That's good.
Thanks so much, Commissioner. And we will be sure to share that with our viewers on our social media pages and also on our Rockdale 23 channel that is viewable by Comcast, along with our website and social media pages. And doctors, let me reiterate this. If you have any other resources or if you'd like for us to share either of your PowerPoints, please email them to me and Sean, and we will make sure that we add them to our COVID-19 tab. And in closing, what I would like to do is pass it over to Dr. Griffin, and then Dr. Griffin, if you will then pass it over to Dr. Carr for closing remarks. And we will wrap up after Dr. Carr. Dr. Griffin, go ahead.
First of all, thank you for allowing me to be a part of this discussion. One of the things, if I could just present, is that be careful about false information that's out there, because there's a lot of false information as far as what you need to do and how you need to do it. I've got a lot of home remedies that have been spread around. So just do your due diligence is finding out basically what you need to do and ask the people who we know have the correct information before you actually put some of these things in your body or your family's or relatives' bodies. So if I could just leave that information to you.
Perfect. Then Dr. Carr, any closing remarks?
I just have to say, I was definitely proud of my hometown. So 2 things. Basically, COVID has affected the life limit of Blacks. They lost about 2.9 years. Okay, so please remember that when you're saying, I don't want to get the vaccine. So the life expectancy for Black and African American has decreased by 2.9 years. The second thing is, if you happen to get COVID and have mild symptoms, please look for a place that has the monoclonal antibody. It prevents hospitalization, it prevents death. Okay, so please, if you get it, find somebody that will give you the monoclonal antibody. It is an outpatient infusion. And I know there are a couple of docs down in Conyers that are doing some trials on it, but there's adequate supply, and we're probably using about 30 to 40% of what we got. So there's plenty out there. So please ask about monoclonal antibody.
Thank you so much, Dr. Carr. And I did want to mention, again, thank you to all the doctors that are with us, whether they're near or far. But in particularly, thank you to all our viewers, especially our Rockdale County residents who are viewing with us, and also any of our viewers that may be streaming this from out of state. And, you know, one of the requests that I was given is to give you some guidance on where you can find information like this. And unless the doctors have any objection, the best way to find the most accurate information in your state is first, I would believe, starting with your local and state health departments, searching their websites. That's where you'll probably get the most accurate information. And also you should be able to access the CDC website from anywhere you're at to also get accurate information. And lastly, you don't have to live in Rockdale County to be able to visit our website. We always like getting those clicks. So you can go to rockdalecountyga.gov and you can click on the COVID-19 tab, and that will also give you some resources. And as you heard Sean discussing earlier, any of the information that we place on that website is not only vetted, but it also is sourced. So you have a sense of comfort and security, not only knowing that the information is accurate, but where that information is coming from. So you can also, ask questions and feel that sense of security. Lastly, even though this person came in a little bit at the end, she's one of my closest friends here in Rockdale County, Miss Karen Stroud Johnson, and she has submitted the last question for the night. And with that, I will read it out loud and let the doctors take a stab at it. Miss Karen submitted, I heard that if you have allergies, you shouldn't get the vaccine. What type of allergies should stop you from getting it? Any of the doctors want to take a stab?
I can start. Am I in?
Dr. Word, I think you just muted yourself, so please unmute yourself.
Okay, I'm sorry. Initially, there were some people who had anaphylaxis that was being reported overseas. There were only a couple of episodes that we had here. They thought it was related to it's polyethylene glycol. And they think that's what that's what was triggering that anaphylactic type of reaction. So that's one of the reasons why when you get your vaccine, you stay. You observe for about 20, 30 minutes. Because if you're going to have a life-threatening reaction, it usually occurs within the first 15 minutes. So if they have you stay at least 20, not much is going to happen after that time period. But it's felt to be the polyethylene glycol that's in it. So oh gosh, did I lose you? Oh my God.
No.
Oh, okay. You just weren't there anymore. I couldn't see. Okay, there you are. I have no idea what happened. But am I gone?
I hear you, Bonnie.
Okay, you can hear me. I just can't see anybody.
Okay, I hear you.
But that's fine. But anyway, people who have significant, and we're talking anaphylactic, where you can't, multiple ones. But right now, before they didn't know what was causing it, they didn't see that many cases when they did it here, the studies here, and it hasn't been a big problem since we've gone out and immunized people. So if you think it's, that's why you would just do it and it would be in a controlled setting. But if you know you're allergic to polyethylene glycol, then that's not a vaccine for you.
Thank you so much. Oh, I'm sorry. Go ahead, Dr. Carr.
I just want to reiterate what Bonnie said, is that the CDC website, the contraindications to vaccine, if you had a severe reaction to a previous COVID vaccine, of course, you don't get a second one. And basically, as Bonnie said, Dr. Word said, it's the polyethylene glycol that's the component that basically people have reactions to. So those are the things right now listed as the absolute contraindications to the COVID vaccine. If you just have like mild allergies and, fruit, citrus or whatever, that's not a contraindication to get in the vaccine.
Thank you all so much for not only the valuable information, but also for your time. I'm so happy and proud to be part of a community in Rockdale County where we have the ability not only to share this kind of information, but bring some of the best from across the country. So please accept our sincerest gratitudes to all the doctors that have joined us again, near and far. Also, I'd be remiss if I didn't close this out with thanking some of the folks that helped us make this possible. Again, Mr. Carr and Reverend Al Sadler, thank you so much for helping spearhead and getting this event for us and letting us participate. Again, also, we'd like to thank not only the chairman, but the Rockdale Board of Commissioners for allowing us, the Public Relations Department, to be able to play a small role in getting this information out to the community. And lastly, again, we'd like to thank our community relations manager, Ms. Melissa Mims, who also played a vital role in helping us bring this event together tonight for everyone. With that being said, you can watch this whole video. It will be not only on our Rockdale 23 television, but you'll also be able to watch it on our YouTube pages and our Vimeo, so you can go back on demand and get some additional information or be able to share this with anybody you'd like. With that being said, I appreciate the opportunity. Thank you all so much. And if there's no objection, we'll bring this meeting to a close.
Thank you.
Thank you for
Thank you all
having
so
us.
much.
Thank you, George. Thank you,
Organized
Sean.
for the second smallest county in the state.
There we
Hey,
go.
the
You
second
got it, buddy.
smallest county in the state, but we have the biggest heart in the country.
There we go.
Hey,
Thank you,
and
George.
obviously the best and one of the best organized.
Totally.
Thank you so much. Appreciate that.
That's pretty big.
I hope you all say that when I come visit you in Houston and when I come visit you in San Francisco. I'm sure they got great food in both, and depending on the time of year, we'll probably be able to enjoy awesome weather.
So September.
That's true.
September.
Okay.
All right.
Thanks,
Sounds good. Have a
everybody.
good night.
Bye-bye.
Thank you.
Thank
Bye.
you.
Thank you.